Carol and Jonathan are here to talk about portable defibrillators, which have really come into the mainstream in the last, what, 5 years maybe?
Yeah, probably since 2008, 2009 was probably a big push.
How many lives do you think these have saved so far?
Well, in BC right now, our percentages for early CPR and AED defibrillation is about 13%.
Wow.
Yeah.
It's a lot of lives.
Numbers are high, and I think some people, myself included, when I look at the idea of using the tool, the know-how is so important. And you guys are actually going to demonstrate this. So if we're in a situation where someone has a heart attack, what are the steps we need to take through when using a device like this?
Absolutely. Jonathan here is going to demonstrate the exact steps that we want to see the public jump into action. And anyone can do this. It is so simple, it is so easy, and it saves lives.
What's your name, or his name?
Her name is Annie.
Annie. Annie just fell to the ground, had a heart attack. What do we do?
Okay, so this is AED in the wall, and Jonathan will go into action.
All right.
Well, first I'd want to make sure that I'm safe, that everybody around me is safe, and that there's nothing that can endanger Annie. And then, firstly, make sure, well, that she's having a problem. Hey, can you hear me? Are you okay? Are you okay? Well, if Annie's not responding, I'm probably going to need some more help. So I'd say, hey, can you go and call 911 and come back and tell me when you've done that? Because we're going to need some extra medical help here, right?
Yeah. Does the cell phone interfere with?
No, 6 feet away. Just keep 6 feet away.
Okay.
Now, once I've got extra help on the way, I know Annie's unconscious. I want to see if there are any signs of life. So I'm going to check for pulse, check for any breathing. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. I don't see any signs of life in about 10 seconds. No pulse, no breathing. So I know I'm going to need to do compressions and get an AED on as fast as I can if possible. So another bystander's gone and got a public access defibrillator off the wall. Getting the AED on first is the key thing. So I'm going to open it up. Get the pads out.
Press the on button.
Press the on button.
Now.
We've already called for help.
Right.
That just means call on.
Clothing from patient's chest.
If they have something on their chest, we have to remove it so we can get access to their skin.
Got it.
How long is the wait time for the average charge before you go ahead with the...
They charge pretty immediately. It slowly walks through the step for the bystander. So we've already pulled the pads out.
Right.
Look at pictures on pads.
Pictures on the pads of where the pads need to go.
Pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
There's pictures and
Press
pictures.
pad firmly.
Got it.
Peel other pad off blue plastic. Do not touch patient.
Stay clear.
Evaluating heart rhythm.
So it is taking the pulse right now. Double checking.
Preparing to shock.
Goosebumps.
Okay, it detects a pulse that it wants to shock.
Everyone clear. Press flashing button.
I just want to make sure nobody else is touching the patient, and then I'm going to...
Shock delivered.
So now it's delivered a shock.
Provide chest compressions and rescue breaths.
And now it's CPR.
CPR, exactly. You just follow the prompts. It will tell you what to do, like Jonathan said. So you don't even actually have had to ever try it. It's got pictures, it's got voice. You can be reassured that you're not going to hurt yourself or anyone. Follow those instructions.
Continue care.
Exactly.
So is it checking the heart rate, or if there is a pulse at this point?
So what the AED does is it will check for 2 types of rhythms. One is called VTAC, which is really, really, really fast and ineffective. Right. And then there's a VFib, which is like Jello type of thing. So basically, if it sees any one of those 2, that's when it will shock. If it doesn't have, the heart is not doing one of those 2 things, it won't shock. You just continue CPR. Continue CPR. The key here, we can turn that off now if that's okay. The key here is early CPR, early defibrillation. And every minute that passes that someone does not have CPR, about a 10% drop in survival. And also, too, our response times do vary in the city, but by the time someone is called 911 and we show up on scene, it may be about 5 minutes. 4 to 6 minutes everything starts to die. The brain, the organs, everything. So we need to act for the heart and get on the chest.
Really quick note on the maintenance of these things. Now that they're more readily available, how often should they be checked to make sure that that they're up to speed to be used?
Well, you know what? Actually, we're in the process right now in the City of Vancouver implementing about 82 AED, public access AEDs, to all the municipal buildings. So sometime this year we'll see them in our libraries, hopefully big theaters, and basically it will be up to the city or whoever will be managing the maintenance and upkeep. But they're fairly simple. They are battery operated, so that would just be looked after by the facility.
So you check like a smoke detector. You just make sure you do it regularly.
Yeah, and fire extinguishers and things like that, and hopefully we'll have them up next to a fire extinguisher. People can see them and use them. That's what we want. Get on the chest, do your CPR, and do your AED.
Do you feel like you could do it?
Great demo for us, yeah.
Absolutely. It's just some sense of calm. I've actually seen one of those save a life at the Air Canada Centre in Toronto. It was magnificent to witness. Don't be afraid of it, but make sure you have your CPR course. I think that is the lesson that we need to learn here. Don't be afraid to get in there and
yeah, we offer amazing community CPR courses through Vancouver Fire. That website should hopefully be out.
Perfect. Thank you very much for the information.